Hi, a lot of times we are not sure of how to handle some minor issues that might arise after a facelift. And they are, minor to us as surgeons, but they can be major to the patients. So we have to address those. We can't just ignore them and say, oh yeah, don't worry, it'll go away now. But it has to be done at the right time, not immediately. Wait for at least 3 months, ideally even longer. So let's take a look. Most common issue is the neck laxity at 3 months post-op. When the edema goes away, suddenly you're left with like lax skin. The problem is really compounded when you have somebody with really loose, thin, like Northern Irish skin, and there's so many wrinkles because there's not enough collagen that you just can't fight those wrinkles. But let's take a look at a couple of issues we have with the earlobe and under the chin, the loose skin of the neck, to see what we can accomplish. This patient already had the facelift. Overall, she's happy, looks great, but we got a few adjustments, so let's go over it. So as you can see right here, we have some laxity of the neck skin, and this is with the skin all stretched. You can see how there's very little collagen, very thin skin, so makes it loose, and that's despite trying skin tightening devices like Soft Wave, and still didn't tighten enough. So it's best to now excise a little bit. We don't want to go below the the middle of the neck, at the superior thyroid line area right there. Any further would be very noticeable. And this is a geometric broken line closure to hide the scar in a more effective way right there. And that's the one issue, and you can see right there. And these, don't make them too small, because books tell you 4 to 5 millimeters. Make them up definitely bigger than that. So then let's go to the earlobe. In this earlobe, patient feels that this is a little loose, and this is a little loose. It needs to be closer to the skin of the cheek. So we have made almost like a wedge incision there, marked it going around it, behind like this as well, and then we will stitch it back together like this. That'll be closer to the cheek skin. There we go. Now let's go to the other side. So here there's a very minor issue. It's the overhang of the skin. So I'm just going to turn the patient a little to show you. There we go. So there's a little overhang, and if you look very closely, it feels like this is going in this area. I know it's minor, but if it bothers the patient, you gotta address it. I think right there, it overhang. You see the overhang? Right there. I'm exaggerating to show you right there. So now, just taking a little ellipse off there, it's going to tuck this in, and then you won't have the depression in there. There we go. So simple little things, but they make a difference for the patient, so just do it. We'll show you the post-op results. Let's take some pictures.